I know for myself I've been very fortunate to have access to very good healthcare and education as I was growing up in the UK. And from speaking to a lot of my friends over here, I've learned that the same level of education and access just doesn't come, or it does come at high cost.
Healthcare is so critical. And if it's not welcoming, then LGBT people are way more likely to not seek out that healthcare.
We're in a unique political climate that is threatening to drive women's health back decades, and we've come farther than that. We can do better than that.
Bridgercare is so accepting of people of all ethnicities, gender identities, sexual preferences. Man or woman is welcome there.
You can come here, speak in confidence to people and really understand what you're going through, and obviously they can help you get the care that you need and all of the advice that you need.
It only was recently that I stopped going to Bridgercare for my health care. It's not the same out there. I think Bridgercare spends the time with their patients to really get to know them, and I've never felt rushed. Even since I was a young woman here, it always felt like whoever was in the room with me really, truly cared.
Everything is as private as you need it to be. You don't always want to have to come to places like this, but when you do, you definitely want it to be comfortable, and you want to feel like you're accepted and no one's judging you for whatever reason you may be here for. And I definitely felt that when I got here.
One of the really amazing things about Bridgercare is it's operated on a sliding scale. So if you're able to pay full price, then you do, and if you can give a donation, then you feel like you're helping out other people, which is great. And obviously the people that need that help, they can get it.
I also wish more people knew how much they're helping our teenagers through peer educators and how they come into the classrooms and really, really make it a safe place to talk about reproductive care and self-care and healthy relationships and things that we really need to be working with teens.
Beginning as a peer educator, I really had to learn how to talk about pretty uncomfortable topics with my peers in high school, which is one of the hardest developmental times, talking about one of the most uncomfortable subjects. And for me, standing in front of a class of people putting a condom onto a wooden penis was mortifying. And since then, it's honestly become commonplace. It's cool to see people really engage because it is so uncomfortable. You started to get people pulling you aside in the hallway and asking you questions. And even if I didn't have the answers, it was a really empowering way to help people become empowered in their own healthcare decisions, or take a step towards becoming empowered in their own healthcare decisions.
Peer Ed has just been such an amazing place for me to grow it myself. I've learned so much about myself. I've been able to be more comfortable with who I am because of the people who are in it. I made some great friends, and it helped me discover more about who I am.
I think that Bridgercare is really important to the teens in our community for two reasons: for our peer ed education and teen clinic. I think teen clinic is really important to us because it's just so easy to come here on Monday afternoons and talk to a nurse about birth control, or get your birth control, or get tested. And if we didn't have teen clinic, I feel like it would just be so much harder to get tested.
I just don't think people have any concept of what is being offered down here and who the kind of people are that are receiving these services and how critical it is to their lives.
Bridgercare, we've never needed Bridgercare more than we do now, especially in the context of the political climate and the funding issues that we're facing. We have so many more people in Bozeman that probably are coming in with higher needs, and we need to be able to support women and men of all ages with reproductive care and general health care.
I think it's a very good thing that Bridgercare is here for the whole community, literally the whole community, to whether that's men's sexual health, women's health, trans health, all of us.
The services that it provides are never going to stop being important. Because if you're not given all of the information that there is about anything from your medical provider, you're really not getting the best care that you could be.
They're providing about the most elemental service that we could ask for in our community.
It is such a wide range of service for so many people that if we fund something like this, we all benefit in such a huge way.